Greetings, PsychU community, and thank you for viewing this podcast. We're here today with Cindy Moyer, who is a licensed social worker and co-founder of Caring Choices, which is a personal health care conversation consulting service. Cindy, welcome, and thank you for joining us today.
Thank you, Mark. I'm happy to be here.
Can you start by sharing some information about your background and what drives your interest in the caregiver experience?
I think I would have to go back to 1993 when my dad died unexpectedly. He was my mom's family caregiver for the last couple of years of her illness. When he died, so did her family caregiver. He was her support, he was her transportation, he did everything that she needed help with. So I had the opportunity to move back home with Mom and take care of her the last 5 years of her life. It wasn't necessarily a role I felt prepared to do, but I felt obligated to do because of being her daughter. It was a rewarding and challenging time. Certainly family caregiving comes with both rewards and challenges, and sometimes it's hard to see the rewards when you're in the midst of all the challenge. I was able to take care of her the last 5 years of her life. And then in 2008, my uncle, who was like a second dad, started his end-of-life journey. So I stepped in and took care of him as well. I unfortunately had to go up against his doctor and ask for an order for hospice when I felt like that was the time. And the doctor questioned my decision. So I did a lot of soul searching and second guessing. And I realized after that experience, I said to my husband, we have to find a way to make this easier for people to deal with, that they don't have to second guess and soul search. And we realized that the best way to prepare family caregivers is to help them have meaningful conversations before a medical crisis hits, so they can start preparing for that role if they're thrust into it of the decision maker or the caregiver.
Okay, great. Thank you for sharing that. In 2013, you co-authored a research article in the Journal of Student Research that evaluated some of the impacts of the caregiver experience. Can you tell us a little about the study?
Sure. It was actually part of my grad school program that we all had to do a research project, and my co-author, Pam Cosper, and I decided we were going to look at the impacts of family caregiving on the caregiver, both physical and emotional impacts. So we really had a long list of options that we wanted people to do in their surveys, and it was checking, did they have backaches and headaches? Did they have aches and pains from caregiving? How did they feel emotionally with the care that they were providing? And we found a lot of different really interesting things about those emotional impacts and the physical impacts on the caregivers themselves.
Okay, so what were some of the key findings from the study?
Well, we found that surprisingly, there were only a few negative emotions that came up, but they're the biggies. There were fear and guilt with decision making, with providing care. Am I doing this right? Am I doing the right thing? We also looked at whether the caregivers were providing what we called high invasive and high intimacy care, things like bathing and showering and incontinence care and ostomy care, those things that are very personal to somebody, or whether the care was low impact, low invasive, and low intimacy, things like making meals and doing laundry and transporting them to appointments and things. So what we found was that the more frequent care, especially the care related to incontinence care or mobility assistance or preparing the meals, resulted in higher total negative emotion scores. So those kinds of intimate care were really demanding for family caregivers, especially if they had never done anything like that before. It really took a toll on them emotionally to do that kind of care. We also saw typical things that would be expected with family caregiving, like an increase in backaches or headaches, aches and pains associated with helping maneuver their loved one they were taking care of, transporting them from bed to chair. So it made sense that those kinds of things would be impacted. Overall, we just really found that the frequency of care and the level of care impacted the caregivers emotionally and physically.
Okay, so based on your experience, what are some ways to possibly reduce the physical and emotional impact on caregivers?
What I always go back to with our work with Caring Choices is have those meaningful conversations before the health changes, before the medical diagnosis hits, before someone is given a terminal diagnosis. make sure that you're talking to your family members and asking them, what are you comfortable doing for me? Or what are you uncomfortable doing for me? Is there anything that you think you couldn't possibly do? We see a lot of times in hospice work, especially, that we have maybe the adult children of a female patient are uncomfortable giving her a bath. Or maybe the spouse is uncomfortable spoon feeding the spouse at the end of life. So we really need to have good, meaningful, direct conversations with people we love to figure out who can do what and when is it going to be a time that we can't keep you at home. Are you okay going to a nursing home? And making those kinds of decisions before that crisis hits.
Okay, so it sounds as if preparation is really key. So what are some ways that caregivers can become better equipped to take on this role and be better prepared?
I really believe in the conversation. There are certainly what-if situations that people can talk about. You know, what if I become immobile? What if I'm bedbound? Who's going to be able to give me the bath? Who am I going to be comfortable with bathing me? Are you going to be able to do all these things that are asked of you in a situation of caregiving? I think, unfortunately, a lot of people just assume that, well, my daughter will do that or my son will do that. We also make the assumption that everybody can do everything and be comfortable with it. And it's really okay to acknowledge that there are things that you're not comfortable doing. You know, for instance, when I was caregiving for my mom, I could not give her a bath. She wasn't comfortable with it. I wasn't comfortable with it. So fortunately, we had hospice care in, and I had the aides there to do that for us. But it was our relationship that didn't lend itself to be a comfortable situation for either one of us. So I don't want caregivers to assume that they have to do everything that's needed. There are agencies out there to help. There are other people in the area, in the family, that might be willing to step up. You know, you always have friends and family saying, just call me if there's anything I can do. And I always encourage people, call them. If there's something you're uncomfortable doing or you can't do it, call your friends and family in to help.
Okay, great. Given that PsychU is a community that's comprised of professionals in mental health care, do you have any specific thoughts for caregivers of patients with chronic or long-term mental illness?
Sure. One of the things that comes to mind is that if you look at research on elder abuse, we often see that the perpetrator of elder abuse is likely a family member who has a mental illness diagnosis, whether it's depression, anxiety, bipolar, schizophrenia, any of those. We certainly want to reduce the numbers of elder abuse clients out there. I think it's important, again, for the family to have conversations. If you know that your family caregiver is limited to your son and you know that he has a mental illness, you need to be talking with him and say, are you comfortable doing these things for me? Are you going to be able to manage it? Certainly, if both the caregiver and the care recipient have a mental illness, or there's a history between the two of them that isn't functional, we really need to have mental health professionals and the medical health professionals involved with the patient step in and intervene and try to make good community resource referrals so that we're getting good support in the home for this family.
Great, thank you. So before we conclude, would you like to share some details of the work you are doing in personal advanced care planning and some of the resources and tools that you've developed?
Sure. My husband and I have been doing community screenings of Dr. Atul Gawande's Being Mortal, which was a PBS documentary that he did, same title as his book. We've been hosting several of those to get communities together to start having community discussions. We find that it's a little bit easier for people to start these discussions when they're in a big group of people and they're hearing other people's questions and comments. We also have started offering death cafes in our area, which are just small gatherings of people in a coffee shop, and we get together and we just talk about anything related to the concerns that people have that are attending. So if they're concerned about aging issues or dying issues, end-of-life issues, we just talk about those in an open forum. We also created our consulting service, Caring Choices, to try to offer personal consulting services to people in their homes where they're more comfortable having a discussion about anything. But this topic, of course, is a daunting one that no one wants to talk about. But we find that it's easier if we're going into their home, into their space where they're comfortable, and talking with them and their family about the what-if situations, what's coming down the road. And how would you decide what to do if you're faced with X? We also decided after my experience with my uncle that in order to help people have meaningful conversations, they sort of have to know what they need to talk about. So with our experience in home care, hospice, and family caregiving, we've run into all sorts of situations and considerations. And so we created a tool that we call Elephant in the Room, because talking about this is definitely discussing the elephant in the room. And it's a set of 96 different cards that are different questions and scenarios that a family can sit around and look through at their leisure, answer the questions as they can, and then write things down so that their family members will have a pretty good idea of knowing what kind of care they want when X happens.
Okay, great. So thank you very much, Cindy. This has been a very interesting conversation, and I really appreciate you joining us today.
Thank you, Mark. It's my pleasure.